This conference will now be recorded.
Good afternoon, everybody. This is Melissa Moran, Whatcom County Health Department Public Information Officer. Thanks for joining us for our media briefing for December 8th, 2020. Just those same few reminders as we get started here today. Please go ahead and keep yourself muted until Erica's concluded her remarks. Then we'll open things up for members of the media to ask questions. We are recording this session and it will be available later today on Whatcom County's YouTube channel and on our COVID page at whatcomcounty.us/COVID. And I think with that, I'm just going to turn it over to Erica to get us going.
Thanks, Melissa. I'm just waiting for my camera to turn on. Good afternoon, everyone. I want to provide a few updates, first on the data that we're seeing, second on our medical surge planning, and then third, I want to just briefly go over what we're doing and what our plans are with regard to Camp 210 and Base Camp. So to start, we continue to see increases, and they have steadily increased in the last 2 weeks in our number of cases and our case rates. 2 weeks ago, we were at 140 cases per 100,000, and we are now at 254 cases per 100,000 people. And just to put that in context, a couple of things. First, that's about an average of 30 to 40 new cases each day. The other item to note is that our highest surge in the summer with the highest case rates that we've seen previous to this was about 80 per 100,000. So now we're at 254 per 100,000, which is really a magnitude that unlike anything we've seen in this county, and certainly matching what we're seeing in other counties in the region. While the upward trend in rates has been quite similar across all age groups, there are marked differences in the magnitude of rates between different age groups. Adults under 60 years old, and particularly those aged 18 to 39 years, continue to make up the bulk of new cases. The highest age-specific rates continue to be among those 26 to 39 years old, with prior 2-week case rate approaching 450 cases per 100,000 people. Though significantly lower than other age groups, we are seeing some increases in cases among those over 60 years old. We are also seeing relatively high case rates continued across school district boundaries, and certainly we're seeing case increases in many of those boundaries, including Linden, Meridian, Ferndale, and Nooksack Valley. Those boundaries have experienced rates between 250 and 350 cases per 100,000 in the prior 2 weeks. We also did kind of a deeper dive on exposure settings, especially given that we are about 12 days after Thanksgiving, and wanted to understand a bit more about whether and if there was impact of Thanksgiving celebrations, travel, etc., on our case rates. We've reviewed all the confirmed cases with completed interviews that had a first positive result date between 10/27 and 12/5. And what we found in that 2-week period was about 75% of our cases in that period were associated with home or a social event. Very few other settings where we saw any significant numbers. Really just, again, focused on the home and social events. And about 42% of those we've been able to attribute to Thanksgiving holiday gatherings or holiday travel. There continue to be no cases for which we see evidence that school was the exposure setting, despite the fact that there are cases in which a person was present in an in-person learning setting while contagious. So that is great news for our school settings and our continued work with school districts to make sure that kids have the opportunity to stay in school if they are there now, or to come back in a safe manner and as quickly as possible. A couple of notes for those of you tracking data. The state was not reporting negative test counts given just the volume of testing that's occurred in the last month. They are starting to add that negative test data, but there are still a backlog of many, many thousands of negative tests. So the percent positivity in our county is pretty skewed. It's higher than what we anticipate it will be once that backlog has shown up on the data dashboard. And then the other item of note, there was a processing error identified on December 4th at the state system. And so there were 3 cases that were attributed to COVID that have then been removed, I believe, in the last day or so. But it was a data processing error at the state level. So just a couple of notes for you on those items. Next, I want to talk a little bit about medical surge, and I think Melissa has a really good slide. If you could share that, Melissa. Our Whatcom Unified Command Strategic Planning Unit, which is headed by the Chief Operating Officer of the North Sound Accountable Communities of Health, Nicole Willis, along with our data team and our planning staff, have been working very closely with partners on medical surge coordination. And this just kind of gives you an overview of all the partners involved and how those interrelate. So obviously we have functions within our local healthcare system like the hospital and our large clinical health providers, our long-term care facilities, which are actually critical in medical surge because they offer a place for people who are COVID positive that are no longer needing acute medical services at the hospital to be able to go and continue their recuperation. So it's a system that allows the hospital to only be really seeing those that need the most acute care and the ICU services, and not holding beds for people because they don't have a sort of drop down in acuity place for those individuals to go. So that's kind of the local system. There's a regional healthcare network, and that is led by the Northwest Healthcare Response Network and others. And our regional healthcare network is focused on the capacity in a 5-county region. Our sort of overflow site for healthcare for COVID patients and other patients is Providence, and so we continue to monitor the rates at Providence, which have and the occupancy at Providence, which has continued to be at a steady and sustainable pace, and of course work with Peace Health on their ability to move patients around within their system as well. Then, of course, there's the COVID response coordination, and there's lots of partners involved with that, and our alternative care sites. So, as you all know, we have a facility on Byron Street that offers quarantine and isolation for individuals, and we also have a medical surge unit within our Whatcom Unified Command. So we have robust plans. We have great partners. It's a regional effort. The healthcare system, whether it's COVID or not, it operates in a regional setting in order to ensure that hospitals are working collaboratively and are able to accommodate the capacity needs of the entire region. So I wanted to just share that work is ongoing and is supported by many organizations. Thanks for sharing that, Melissa. If you want to take that down, good, thanks. So the last thing I want to talk about is our efforts to work with the City of Bellingham and the organizers at Camp 210, the City Hall encampment, and we've engaged in all of our public health tools. We've provided resources, campsite specialized plans and recommendations. We have provided masks, other PPE, other hygiene items. We've provided no contact thermometers. We do daily site visits there. We have now tested twice, and we plan to test again later this week and continue with twice weekly testing as we monitor the situation, and really are trying to support both the city and the organizers of Camp 210 to ensure that that some of the safety and health measures to contain coronavirus are implemented and can be allowed to work. That said, we're also working to utilize our Byron Street facility for some folks to help with the crowding there and be able to provide additional support for this population, as well as working with base camp. So that's just kind of a brief overview. I put out another memo yesterday highlighting some of our concerns and really the urgent need for continued testing and testing participation, as well as taking additional safety precautions. So we are working with the organizers on that, and so far we're getting some changes made that we believe will help protect that population. And this is a population of people that we're particularly concerned about at risk for severe illness because of potential comorbidities. We know that diet has an impact. We know that substance use disorder puts people at greater risk for severe illness. And I'm not saying that that's something that everyone has an issue with at the camp, but that can be a concerning comorbidity, and of course behavioral health issues and other pre-existing conditions can put people at more severe risk for illness. So we are very concerned about this population and are working daily to try to address that from a public health perspective. The last thing I want to say, and this may or may not be the last media briefing of the year. We haven't talked about when our next media briefing is, but I want to acknowledge and thank the role of our media partners this year. It has been incredibly challenging for all of us, and I know that many of you are working as much as all of us at the health department to try to put out timely and relevant and accurate information, and we really appreciate the partnership and your interest and continued participation in media briefings and work with our communication team. So thank you, and I hope you all have lovely holidays. I hope you're able to take a little time off, as we're all hoping to do as well, even as things can continue to be very busy and very challenging. So thank you.
Thanks for that, Erica. And I just want to echo those sentiments of gratitude for all that you've all done. Thank you. We've opened up the chat feature, so if you have a question that you would like Erica to answer, please go ahead and type your name and affiliation into the chat, and we'll go ahead and have folks unmute yourselves to ask your question as they roll in.
Thank you for that clarification too, Melissa, in the chat box.
Oh, yes, I will just also for folks who may be seeing this online later, just note Erica shared earlier some stats about exposure settings, and we just wanted to clarify that 42% of the cases who we expect the exposure setting was a social gathering were related to Thanksgiving, so not 42% of cases overall. And that applies to cases that we reviewed for a date range of November 27th through December 5th. All right, it looks like we have a question from Robert Mittendorf. Robert, go ahead and unmute yourself to ask your question. Robert, I think we're getting a bit of feedback from you. Are you there to ask your question?
Robert, it sounds like you're moving boxes, but we cannot hear your
I'm going to
voice.
go ahead and pause. And
Okay.
Robert, we'll get back to you. It looks like we also have a question from Key Relia. So Key, go ahead and ask your question.
Yeah, hi everyone. Thanks for taking the time to talk to us today. Erica, can you tell me about the testing results at Base Camp and Camp 210? Are there any new results for the tests? I know the last I checked there were 6. Is there anything new to report on that front? Thank you.
Sure. We are still awaiting some pending results on the testing that we did on Sunday at both sites. There are a total of 7 cases between the 2 sites, but we're still awaiting additional test results.
All right, thanks, Erica. I'm going to go ahead and just jump down to the question that Robert's typed into the chat here. Robert's mentioning that there was some audio issues with the first few minutes of your county council briefing. Can you say more about what you shared related to the vaccine in that council meeting?
Sure. Yes, there's a lot, and the wind and the weather are creating an unstable internet connection for me today, unfortunately. So there are a lot of unknowns with vaccines still. It's the 2 most promising and furthest along vaccines, the Pfizer and the Moderna, still have a process to go through, both at the federal level, but also at the Western Regional Compact level. We do anticipate receiving, I think the number is about 62,000 statewide in the next couple of weeks. And that may look like, I couldn't estimate, but it may be 1,000 or 1,500 doses for Whatcom County, given that that's a statewide number. So that will predominantly go to our healthcare providers that are providing services directly to COVID patients and others that may have been exposed. So it will be a process. We are incredibly happy to see that there's movement on the vaccine front, and look forward to continued vaccine in our community. But for now, there's pretty limited supply as these 2 companies work to get up to speed and go through the final process of approval.
All right. This question is from David Rasbach with the Herald. David, go ahead and unmute yourself.
Hi, Erica. Thanks for your time. You mentioned that in your deep dive into the study that about 42% of the cases that were from home and social events were attributed to the Thanksgiving holiday. Obviously, that's the first of many holidays coming up. What does that data tell you, and what advice would you give to Whatcom County residents as they start looking at what they should be doing for the holidays that are on the way?
Yeah, the data certainly tells us that the risk of exposure and spread, even among small family activities, small group events, is there. It's causing spread. It's causing the most significant type of spread in social events and activities. And certainly for Christmas and New Year's holidays coming up, and other holidays coming up, we do continue to recommend that people celebrate just with their immediate household and find creative and loving ways to celebrate with family members outside their home or out of state. We still have the travel advisory statewide and ask that people don't travel for the holidays. We ask that people don't celebrate, especially with mom and dad or grandma and grandpa who may be more at risk for severe illness. the message remains the same. We hope that the data shows that there is significant risk, and it's not a risk that any of us would want to take if it comes to infecting our parents or grandparents.
Thanks for that, Erica. I don't see any other questions rolling into the chat, so we'll do one last call here. If you do have a question, feel free to, and just in time, Key, another question, feel free to ask that.
Okay, thank you. Erica, going into the Thanksgiving holiday, the health department had asked people to avoid getting COVID tests as a way to screen for the Thanksgiving holiday because it was taxing the ability to test at the mobile sites. What are your thoughts about screening tests going into the Christmas, New Year, and other holidays? Should people do them or should they not?
Well, screening tests are just that. It's a point in time of, on that particular day, if you have enough, or if you don't have enough of a viral load to have a negative test. It doesn't tell us what your exposure has been. It doesn't tell us what the likelihood that you will convert from a negative to positive. And it certainly is not the end all be all of whether or not a person is safe to be around others. As you all may remember, I think one of the best examples of this was earlier in the summer when we had a fishing vessel dock in Bellingham, and everyone on the ship 2 weeks prior had tested negative and 85 tested positive just 2 weeks later. So a negative test doesn't always mean negative. It just means negative at that point in time. And therefore, it's one tool. It's a tool that we need to use in coordination with contact investigations, but it's not an effective, it's not a free pass to see friends and family a few days later because it doesn't always indicate that there's a negative test there. And so there is a travel advisory in place. It is not our priority to test people for screening so they can go see friends and family, which is not at the advice of both the state and the local health department. And we do have constraints in terms of our ability to test, and we need to make sure that we're prioritizing people who are symptomatic or have been identified as a close contact over people who want to go to Hawaii or visit family and friends. We have to prioritize. And so we ask people not to have screening, but really just stay home and stay home with their immediate household.
Thanks, Erica. I see another question here from Robert asking for a bit of a summary of Dr. Carlo Puti's presentation to the County Council today. So Dr. Sudhakara Carlo Puti joined Erica, Chief Medical Officer from Peace Health, and just asking for a bit of a summary of the details that he shared at that presentation.
Yeah, sure. He can tell it to you best, but I think the very brief summary is the hospital is well supplied with competent, well-trained staff for surge. They are well supplied with PPE, with therapeutic medicines for COVID, and with supplies needed, including ventilators. Dr. Carlo Puti also shared that obviously Peace Health is a pretty large network with hospitals all over the state and the region. And if they were running low on any of those items, supplies, medicines for therapeutics, PPE, etc., that they could reach out to the network and have some supply delivered within 5 hours. He did mention that. So, it sounds like they're monitoring it daily, and they understand what their burn rate is, or how many they go through of these supplies and PPE in a day, and they're really tracking that closely, so they feel very confident that they have the supplies that they need.
All right, do we have any final questions? Okay, I think we'll go ahead and close out today. Thanks again for joining us, and look out for this to be posted shortly on our YouTube channel and on our media page.
Thanks all. Happy holidays.